welcome to everybody again to this session, which is a KCIL session Q&A on the vaccine with NHS South West London. And we've got Fergus Keegan here from NHS South West London to take us through the Q&A and some information on the vaccine. And we want to sort of state from the outset that we understand that the issues around the coronavirus and the vaccine are incredibly sensitive, has meant loss for many people, and also that around the vaccine, that we are not here as an organisation to tell people to take it or not take it one way or another. We are not experts on the vaccine. We are handing you over to NHS to give you information so that you feel best informed to make a decision over whether or not you do wish to take it. So it's a very open forum here where people should not feel like they're in any way pushed in one direction or the other. So I'm now just going to hand over to Fergus, who's going to introduce himself, let you know what it is that he has been dealing with around the vaccine, and we'll sort of get started on the Q&A. Over to you, Fergus.
Thanks a million, Kimberly, and it's really nice to be back on the coffee morning. I always worry if I'm invited back a second time. That means, did I do a less than perfect job the last time and I need to come back to clarify a few things, or alternatively that I did such a good job that people thought it'd be nice to come back a second time. So lovely to see some familiar faces. I hope we're not going to have too much repetition from the first session, but really happy to take any questions that people might have around the vaccine itself. Things I want to touch upon are around safety and effectiveness, and really helpful to have that update from Melvin and the team at the local authority about some support for how to get access to the vaccine. Melvin and the team have done a fantastic job helping us to develop a whole new system of how we deploy vaccines, not just in Kingston, but across South West London and London more generally. We've also got a little bit of time, Kimberly, if that's okay, or there are questions around things like some of the more negative messages that might be appearing in the media or in social chat groups and social media and things like that. I'm really happy to take some questions on that. Maybe some advice about scams as well. So we're aware that some parts of the country and indeed in London, people have reported some concerns about how they've been contacted. So maybe give some people some advice for people about what to do if they're contacted that way or what to expect. And I'll probably start with a little bit more about me and how South West London are managing the vaccine programme this year, if that's probably helpful. And then if I do that overview, you can take me through questions that people might have asked, so we've got some framework. Is that okay?
Yes, please. Thanks, Fergus.
Okay. So as I say, my name is Fergus Keegan. I am a nurse in the NHS. I've been a nurse for almost 33 years now at this stage, and I've been working in the Kingston and Richmond area for almost 10 years. In fact, some of the faces on the call I've seen from other roles when I used to be the Deputy Director of Nursing at Kingston Hospital at one stage. I'm, as Kimberly said, here to talk to you about the vaccine programme. I will help you to make an informed choice, but you have to make your own choice about what to do with regards to the vaccine. But I'm really pleased to say 15 million people or so now have made that choice to have the vaccine. Boris Johnson was very keen to set a stretching target for the country to make sure the vaccine is delivered. The NHS, your GP, your community pharmacy, your nursing teams, your local authority colleagues, and a huge number of volunteers have worked very hard since the middle of December to make sure that all of the people in the most at-risk groups from the virus have been offered the vaccine, and the vast majority have taken up that offer. For South West London, that's Kingston, Richmond, Merton, Sutton, Wandsworth and Croydon. That number is close to 270,000 as of yesterday, people we've been vaccinated. And they are the top 4 risk groups. So people who live in nursing or residential homes, people over 80, your frontline healthcare staff and social care staff, people over the age of 70 now, and people who are clinically extremely vulnerable. We're starting to work further and further down through that list. So it's been a Herculean task, but since I was last here, was it about 3 weeks ago, Kimberly? 3 weeks ago or so?
End of January.
we hit the targets that the government set for South West London and for Kingston to make sure that we got the vaccine to as many people as possible in as many different ways. And I'm really pleased to say that will offer the support and protection that people need to help them prevent them from getting the virus in the first place, or if they do contract it, it will diminish the seriousness of the virus's impact upon them. Shall I pause there and say?
Yeah, so I think what would be good is you mentioned that there'd been some things on social media and that sort of thing. So our concern here is making sure that people have access to, as far as possible, official information. But what I thought it would be good is, could you give us a bit of an idea, which will touch upon the things that have been in social media, but could you tell us the background to actually what's going on in hospitals with the staff, the doctors, the nurses, the support staff, what they're experiencing?
Sure.
So I know there's been question where people aren't sure about data and things like that, and perhaps if you could tell us what's going on in the hospitals, for those of you who don't have doctor friends working in hospitals and other support staff, as I would, so I've heard it firsthand, could you tell us more about that?
Okay. Where will I start? Okay, so if you watch the news, BBC News, every evening, at some point you'll see a graph that they put on the chart on the television, which shows how many people have tested positive for the virus. And South West London is no different in terms of the shape of that graph. Over the last year, we had a big surge in people who were testing positive for COVID-19 through April, May, and then it tapered off through the summer period. But it came back with a real surge through November, December, and January. And part of that surge in the level of positivity, or how many people who had the virus, was why the government made their choices about the tiers of lockdown, and indeed the lockdown, the restrictions that we're facing now. The number of people testing positive, if I talk about South West London, at the height of that in January was about 14,500 people every week. So we were testing about 45,000 people every week. And of those people, about 1 in 3 were testing positive. Remember, not everybody who tests or who is symptomatic or has some symptoms of COVID gets tested. So we know that some people don't have symptoms, but overall there are sort of headline numbers. About 45,000 people were being tested every week, and about 15,000 of those were testing positive. Of that number, and again, I do want to reassure people, the vast majority of people who contract COVID do recover from the illness, but for a smaller number, they become unwell enough to be admitted to hospital. And we had, during that period of time, about 1,200 people, 1,200 people in the 4 hospitals in South West London: Kingston, Epsom, St Helier, St George's and Croydon. About 1,200 people each week were in hospital in our beds who were so unwell with COVID-19 symptoms that they couldn't go home. And then for a smaller subset again, they require ventilatory support or mechanical support. So that's a machine to help you with your breathing, or indeed the support of an intensive care doctor and nursing team to look after you. And during, again, the peak through January, we were looking at about 150, 160 people in South West London every week were in our intensive care beds. So all in all, we know that the virus for the majority of people is relatively straightforward, particularly if you're young. But if you are older or you have other risk factors, you're more likely to become seriously unwell, more likely to require admission into hospital. Of that, a subset require significant support to help them recover. And sadly, for some people, that isn't a recovery, that's that the illness has resulted in their death. And across the country, we've now gone through in the new year a level of just over 100,000 people have died as a result of the virus. So that's with the virus or having been tested recently for the virus. That's the number of people who've died. I don't want to go into too much around that because I know it can be upsetting for some people on the call. But it is very difficult for our nursing and medical teams because in addition to trying to keep the rest of the NHS going, so we still have to have cancer services running, we still want to run our opticians, we still want to make sure that people have access to accident emergency, we need to make sure our district nurses are still visiting, and they have this new amount of work on top of what would be their normal work to do as well. And I think it's quite disheartening, I think, for our nursing teams, particularly those that are in pardon me, those that are in places like intensive care or the acute medical unit, where they see the sickest people coming in, and high numbers of people coming in extremely unwell in a short period of time, and sadly some of those dying as well, has meant significant emotional burden as well as the physical burden of the work that they're doing. I've been in this for over 30 years. I have not seen, and so my background was in accident emergency as well. I have not seen a winter like we have had over the past year in terms of how busy teams have been. And it doesn't always come across when if you're visiting hospitals or if you're visiting your GP, you may think that they don't look busy, but that's part of our job, is to make sure that we segregate people and how they're being cared for away from the public eye or away from line of sight. But I can absolutely categorically tell you our GPs, our district nurses, our physiotherapists, our nursing and medical teams in hospitals have worked their socks off over the past year, but a very difficult time over the last winter period to make sure that people are well looked after and they're safe. They do a fantastic job, and they're rightly proud of the work that they do. But part of the work we do is dependent on us as society working together. And that's where we come back to those very simple but straightforward messages about staying at home and not going out unless you need to, keeping your distance away from people if you are out and about, making sure that you're wearing a face mask. If you are spending time indoors, if you pop into a coffee shop or something like that, make sure it's the minimum amount of time, that those places are well ventilated. And as Florence Nightingale said, keep washing your hands.
Thank you for that, Fergus. So that's, I think, good for people to hear, because when we hear statistics, it's very easy to sort of question and wonder about numbers being given, but the human aspect of actually, I don't know how many people it would be who work in direct medical support, so that would be doctors, nurses, but also the support auxiliary staff and things like that, managing the hospitals, how many that would be over the UK who are having this experience.
So for South West London, it's about 28,000 staff who are employed in the NHS. That's everybody in all sorts of roles. And a similar number for social care. And that's all of the different types of roles that people work in local authorities.
So across the UK, we'll go into the hundreds of thousands. All the
the NHS is one of the largest employers in the world. In fact, I think it's well over the million mark. And health and social care, definitely. And of course, recognising including the people here, people who provide support in a non-paid way for their family members or friends. So yes, you're into a couple of million people.
So a couple of million people who could tell you what's happening with the virus from a direct point of view. So not just the newspapers and sort of government talking at us, that there are real people out there who can give you experiences. What would be good is, in terms of talking about what are any of the main barriers to people choosing to get the vaccine that we're aware of at the moment. I know in the last Q&A you mentioned, for instance, that certain ethnic communities had an issue over the Pfizer vaccine. So it might be good if you just mention that again. Any other things that have been identified as a barrier to getting the vaccine for people?
Thanks, Kimberly. And I think, so probably the biggest barrier, the question people have is it safe? Is it safe for me to have it? It was developed very quickly. How well or how rigorous was it tested and that type of thing? So one of the first things to overcome is to reassure people that it is a very, very safe vaccine. In terms of its development, it would have been tested on 40,000 people as part of that program. And the science behind that then is scrutinized by, we have every part of the world has their own regulatory authority for how we approve vaccines. So in the UK, it's called the MHRA, Medicines Regulatory Authority for us. In America, it's the FDA. There's another one in Europe. All of those bodies have now approved their vaccines in their own regulatory requirements. I think the other thing I would say, which is when coming back to how many people we've vaccinated, we know now that we've vaccinated 15 million people. And the evidence is that very, very, very few, a tiny, tiny minority, have any sort of significant adverse reaction to it. And very often that's for people who have had some sort of a significant allergic reaction in the past. The vast, vast majority of people who have their vaccination, either first or second dose, will have a couple of uncomfortable but not unfamiliar side effects as a result of it. So painful site from where the vaccine was administered in your upper arm, in the muscle here. It can get a little bit red, it can get a bit inflamed. Some people report that they have a headache for a day or two afterwards, and some people just feel a bit like you're a bit run down and a bit jaded. They might feel like that for a day or two. And for most people, that's all that they will feel as a side effect as a result of having the vaccine itself. So when we were talking about developing the vaccine, we tested on a population, and then we draw inferences, we get results from that, and we draw that out and make assumptions about what that might look like for the wider population. For 15 million people that have been done now, we're very clear this is a very safe vaccine that we have, the two vaccines that we have in the UK. I think the second part of the barriers is about, is it effective? Is it worth me having it? Does it make a difference? And there's some it's really interesting emerging information from countries where they have had really good progress with vaccinating their population. So the UK is about third or fourth in the world in terms of the total number of people who have been vaccinated. Israel is one of those countries that have now got some evidence that are showing, as you vaccinate people, the number of people who get admitted into hospital and become seriously unwell has dropped right down. And we're starting to see some of that information come through in our data in the UK as well. It's too early for me to say this is definitely the case. That in the next week or two, I think we will have more and more evidence around that. But a combination of the lockdown, I'll use the common term for a combination of the lockdown and the numbers of people who've been vaccinated, that is now showing through in the total number of people who are testing positive. So if you remember when I said at the height of problems back in January, just 6 weeks ago, we had about 14,500 people testing positive every week. That number is now down to 2,000 people. The number of people who are coming into hospital is reducing week on week as time passes. So we know that a degree of protection is there from having the vaccine, and we can start to see some early signs that that's having a real positive impact in the total number of people who are testing positive, but also then the number of people who are becoming unwell or becoming seriously unwell. We'll need to monitor that in the coming weeks and months. We can't put a definitive figure on it protects you to this percentage and will prevent this amount of deaths, but that will come as time passes. What I can say is we know that from the evidence so far, it's very, very effective. The last bit that I would mention is about coming back again to the issue of whether I should have it or not. People sometimes say, well, actually, if it doesn't completely protect me, why should I have it? And I guess my short answer to that is the benefits of having it are significant and the risks of having it are very, very small. But if you contract COVID, the complications of having it are very serious. The consequences of catching it can be very, very serious for a small number of people. And so if you sort of think of it a bit like a seesaw, one far outweighs the other. The benefits of having it and the risks of having the vaccine, for me, significantly outweigh any of the consequences of not having it, or the risk that you would be taking of not having it. I think the last thing I would say on that was we just need to recognize too how fortunate we are within the UK, how privileged we are. And there are other parts of the world who would love to have the health service that we have, the support that we have for access to healthcare, and indeed the supply of vaccine that we have. For me, we're in a privileged position. We're very lucky to be able to offer it to people as quickly as we have been and to be able to mobilize as many people as we can to have the vaccine. For me, I think it's a really important thing that we recognize the privilege that we have of being able to do that.
Thank you, Fergus. So in general, a key point there in terms of choosing to have the vaccine or not is try and weigh up everything. So not just focus on the risk factors that concern you, but actually look at the benefits as well, and then weigh it up, because I think people can get very focused on obviously the risk side of things, can make them anxious. So I think that was a really good key point. You did touch on, of course, that sort of looking at statistics, we're starting to see that as vaccines are increasing, that cases are going down. I think probably at the moment we're mixed in with lockdown plus vaccine, so it's hard to see how much is actually directly related to the vaccine as opposed to the lockdown over the last few weeks. But previously what they've said is if you have the vaccine, you can still get COVID, but you just won't be really sick with it. And therefore you also can possibly still transmit it. So where are we still saying that? Are we saying there's a level? Does it reduce risk of contracting and transmitting? Where are we with that?
So the evidence is that no vaccine gives 100% coverage to prevent you from getting the illness. And this vaccine is no different to that. It will significantly reduce the risk of getting it, but it won't eliminate that completely. What we do understand is that it is reducing the seriousness of the illness when you do get it. And if you're one of the small percentage of people who might still get it even though they're vaccinated, the seriousness of that illness will be diminished. I think again it's helpful to remember that the strategies that we have around wearing face masks, washing your hands, keeping your distance will remain in place for some time. So whilst I'm really pleased to say we've administered the vaccine to the high-risk groups, there's still 40 or 50 million people in this country who have not had their vaccine yet. And therefore, for those groups, whilst the illness might not be as severe, there is still a danger that they will be able to communicate or contract the illness and communicate it. So we need to be very vigilant when we open up our schools. We need to make sure that as we open up the non-essential shops, we need to be very careful when we get back into the social side of things around pubs and restaurants and bars and other places that people come, that the virus is still there. The vaccine doesn't remove it. What it does do is help us diminish the amount of virus that's circulating in the system. So key messages will still be from central government, from the NHS and other partners, is you need to be very careful about making sure that you maintain your distance, wear your mask, wash your hands and the like, because that will be part of the strategy. The vaccine is only one bit of the armory, if you like, that we wear in terms of our defense against this. And of course, we have to remember that the coverage or the benefit of the vaccine is not forever. Over time, the benefit of it will reduce. So we're already starting to hear now from government and from the Department of Health that it's likely we might end up with an annual program, a bit like the flu vaccine that we do every year. So every year we'd modify the dose that we give, the type of vaccine that we give every year for the flu virus, because the flu virus changes a little bit year on year. We might have to do something similar to that for the COVID vaccine. And a top up or a booster might be necessary, because at the moment we know that it gives you a benefit, but we haven't got long-term evidence to say that it would last 8 months, 12 months, 18 months. That is still yet to be evaluated, because we started our big scale vaccination really only in December. It's really only been 8 weeks since we've been doing this amazing thing. It feels like much longer for me, but it really is only 8 weeks. So some protection will still be needed in terms of how we behave and how we interact with people to reduce the risk to the lowest level possible. And we might need in future some additional support from for further doses, or a top up, if you like, of the doses that we're offering at the moment.
Thank you. So in terms of coming back to barriers that we know about, so we've had things, for instance, that I've seen culturally related, so not actually related to risk factors. So what of those have we identified? One I'm thinking of, for instance, where there was a concern over the amount of ethanol, i.e. alcohol, in a vaccine.
Yeah.
I don't know, it was equated to the same as in a slice of bread or something. But any of those sorts of things that we can bring up and just address that are not risk associated, but may have a culture association.
So there's probably quite a few, but again, so my starting point would be speak to people who you trust. Speak to people who you would take advice from on all sorts of matters. I think your GP is a very good source of advice and information, the NHS website itself, but culturally then thinking about your faith leaders or community groups. They very often are, they have been working with us to try and help make sure we get a clear message and an accurate message out. So there are some groups, for example, who are concerned about some vaccines have had a porcine or a pork element in their development. For those faith groups where that would be something that they wouldn't be able to engage with, I can absolutely be clear there is no pork or no porcine element, animal products involved in the vaccine that we are administering at the moment. For other groups, some of our Black and Asian minority ethnic communities, they have a different attitude to government and central control, in that there sometimes is mistrust with government agencies or government bodies. For me, again, I think it is about talk within your local community, talk within your local faith groups and your community groups, go to places for some trusted advice. It's very difficult if you're looking at Facebook and WhatsApp and things like that, where you're getting messages that very often are targeted at specific cohorts, whether it be South Asian or North Asian groups, and where the messaging is targeted to tap into some of their fears and their anxieties. For me, I would say think about where you're getting your trusted advice and your sources of information from. The NHS website is a fantastic repository of data, absolutely accurate, very up to date. To make sure that you're looking and listening to those. There's lots of social media giving the balance to the message that we're talking about here. I think also there's a role for all of us about how we role model and how we talk about what our own views are. So I know that we have been working with local authority colleagues and others to ensure that people who are representative of their community are talking about the vaccine. I'm white and I'm Irish. For some people, they will see me as a trusted person because of my profession. For others, they won't. They would prefer to hear that from somebody who speaks the same language, has the same faith, who's from the same country of origin, or culturally aligned in some way. And I'm really comfortable with that. I think what we want to have is as many voices as we can, talking in the right way. This is a respectful process. We recognize that for some people, they will take all of the information and make their own choice about that. And I think that's the right thing to do. But I think you also need to bear in mind that the choice you make is a benefit just not for you on a personal level, but also for your wider community too.
Thank you. And sort of talking about trust, can we just briefly cover the concept of scams around the vaccine? I know they've been reported in the media, and also I can say that my father has received 2 text messages too from the same thing, trying to get him. And when he went to his chemist to say, what do you think about this? The chemist said, oh, maybe they're trying to get you in for the second vaccine, and didn't give good advice. So now officially, can we talk about what forms the scams might take and what we should be aware of, or perhaps the only way the NHS will contact you for the vaccine?
Well, so that's a tricky one to say the only way we'll do it, because we're, as we heard earlier, we're trying to develop this as we go along. So at the moment, and again, the scammers are very clever, aren't they? Because they tap into the things that we do and try and hide in amongst the things that we do. So we will contact you by telephone, or your GP practice might text you, and you might get a letter either from your GP or from the national team. I guess the thing that I would say to you is that there's several important things here. We will never ask you for any of your banking information. We will never ask you for any of your passport or your driver's license, anything with a photo ID. We don't need any of those to be able to offer you an appointment. We won't ask you to, we won't turn up at your house and offer you a dose without having agreed in advance that we're going to do that. So you would expect your district nurse or your GP, they would have contacted you and said, we're planning to offer you your vaccine, and we'll be coming at such and such a date or such and such a time. It might be a morning or afternoon. Or we would come with one of your expected nurses. So if my nurse was coming to visit me at this point in time, then at that point in time, they may use that opportunity to offer you the vaccine at that stage as well. There is no money exchange. There is no need for you to offer any reimbursement. Somebody who's seeking payment for it is not going to be doing it in the right way. And the other thing which I need to say is you can't have it privately. So you can't phone up the New Vic or the Park Hospital, anywhere like that. They're not able to offer it. So anybody who's offering you a private supply or a private dose, that isn't related to the NHS. These things change. They're very good at changing very rapidly, the scammers. So I think what I would say is there's some advice on the FAQ pamphlet, I think, that Hannah has circulated. There's a little section within there. There's a website or a reporting link that you can go to if you think somebody has been in touch with you. Share that information. That helps us get on the front foot to prevent things from happening. But if you're in doubt, phone your own GP surgery, finish the phone call, put the message down, go through your normal route, pick up the phone and contact your GP surgery.
Okay, so the bottom line is, if in question, the person you can check with is you go direct to your GP surgery. Yes, and so in terms of reporting scams and things, we'll send that information out. We did circulate links. We put the frequently asked questions document provided by the NHS onto our website, and we have been sending the link out. So for everyone who registered, you should have had a link to read those FAQs before you came today, and obviously that'll be, we can send it around again afterwards. So I don't know if this might be a time, as we're sort of coming to 10 to 12, whether or not we open to the floor. I know Jason had a question, but it sort of relates to government guidelines about how we are able to move around, and it was the concept that if people are starting to get vaccinated and being safe, can we, I suppose, not follow directly government guidelines? Jason, is the bottom line on that question. But perhaps if people ask directly, if they've had any questions from this session, that you can now unmute yourself, you can put your hand up and we can sort of see who wants to ask a question.
Just while we light that up, and for Jason, at the moment it's the law. So you need to comply with the law. The law it determines how far you can go, how many people can meet. I'm not able to answer about the law and policy and politics, but I would encourage you to comply with the law. I think the police are good at fining as well at the moment.
it's a question that one of our members asked, and I promised I'd get back to it.
So I suppose. Sorry, Jason.
My initial response was, it's the law, but as I've got you, ask the question.
I mean, I remain optimistic, like everybody, that this summer we're going to have a fun time, that we'll be able to go out, we'll be able to mix with people who we care about and spend time with. But we've got this standoff at the moment between there's too much virus around, and we're not there yet with the vaccine program. So be patient with us. I think we all want to get there. I miss that human contact. I miss getting out and about. But my clear message is the law is the law at the moment. Don't deviate from that, because the police are getting very good at hitting people with a fine if they don't listen to them when they're offered the advice.
Okay, thank you. So we've only got Fergus for a few more minutes. Now, what we've touched on here, what we've talked about getting the vaccine, not getting the vaccine. We do have David Ashley here from Mark Bates. So they are our insurers for our employers. And he's going to talk a little bit around the legal aspect around whether people are choosing to get the vaccine or not if their employer has asked them to get it. There are a couple of updates. So I think if David introduces himself, when he gets talking, that it may sort of switch back to Fergus while he's still with us. So just before we transfer over to David, because this will link in, Fergus, could you give advice to people who aren't getting the vaccine at the moment, if they're in a situation where they're in contact with people who perhaps might be vulnerable, whether or not they've had the vaccine? So we're talking about relationships like the employer and their PA. What guidelines are there for what they can do if they're not getting the vaccine at the moment? What is the best way to be cautious?
So I think it's the same infection prevention control approach that we would take if we were looking after patients in hospital. So if you're indoors, it's really helpful if you both are wearing a face covering. I think you minimize the duration of time indoors. That's got to be balanced with the care and the support that you're receiving. It's difficult at this time of the year, but ventilation is an important thing about changing the air in a room, having a window open, having a little bit of fresh air into the room. It'll be easier as we get into the summer because we can have the windows open and the like. But wearing a face covering, minimizing the amount of time in contact with each other other than for what's necessary. Some ventilation in the room, they would be probably my top three. I think keeping distance, because sometimes that support can be, and you can talk about what it is that you're doing and how you're providing help. So maintaining a bit of distance is helpful too. And of course, washing your hands, as I've mentioned. It's such a silly thing. And I know Boris, when he was singing happy birthday and rolling up his sleeves, and people were sort of tittering a bit about it, but it's one of the most fundamental aspects about how to reduce cross-contamination, making sure your hands are really clean. They're my top tips. Kimberly, you're on mute.
Thank you, Fergus. It's going to be the eternal refrain. So I want to say, just in case he does have to go before any questions come back to him, a huge thank you to Fergus for joining us again today. The last session was incredibly popular, and we got really, really good feedback. A lot of support was provided after the event, both by NHS South West London and by RBK, where we had Melvin here.